So a couple of big milestones in the past couple of days. The one we reached today here in Arizona, 1 million people have gotten the COVID-19 vaccine fully vaccinated. Dr. Cara Christ, heading Arizona's Department of Health Services, joining us live. Dr. Christ, always great talking with you. Congratulations. Is this right on schedule for you? Is it happening earlier than you thought, later?
So it's happening right on schedule. We anticipate, we hit 1 million Arizonans fully vaccinated, 2.5 million doses administered. This is great news. We look forward to continuing through our age prioritizations and having everyone eligible for vaccine by May 1st.
All right, so take us through this. What does it really mean? We have about 7.5 million people in our state. We have 1 million people now, and I don't know exactly where they are in terms of, you have to wait a couple of weeks, I think, after your second dose to have it fully take effect. But are most of our at-risk people, would you assume right now, protected from COVID?
So the highest risk for severe outcomes from COVID is our older Arizonan population. And so as we move through that, we anticipate that about 60% of everyone with a chronic medical condition is currently covered under our age prioritization. We've hit nursing homes, assisted living, group homes for the developmentally disabled, our healthcare workers. So our most at-risk populations have been covered.
And you would think then, because of that, that we should really start, and we have been seeing this, the people hospitalized with COVID is dropping precipitously.
Yes, we are seeing decreases in our hospital utilization rate, both in our med-surgical beds, our ICU beds, the number of people going to the emergency room. These are all good signs, and this is what we were hoping the vaccine would do.
Okay, so the number one question I get, and I think we've discussed this in the past when people are reaching out to me on social media and things, is when am I going to be able to get the vaccine? So you mentioned May 1st. I understand there's also something coming up April 1st. I don't want to get ahead of myself. What's the next phase of vaccinations? What age group? So we're at 55 plus now. When do we move down to the next age group?
So we anticipate moving to the 45 and above by April 1st. And then a couple of weeks after that, going to our 35 and above, and then by May, having everyone 16 and above eligible.
Wow. And what is that going to mean for us here, Dr. Christ? When everybody basically who wants a vaccine gets one, what is that going to mean for our state?
So that's going to mean that we're going to see, our hospitalization rates continue to decrease. Those that want to be vaccinated will be able to follow the CDC guidelines. When you're in a room with somebody who's who is vaccinated, you can take your mask off. You don't need a physical distance. This is going to get us back to a sense of normal.
Right, and that was my next question. So if everybody who wants a vaccine should get one, probably by the end of May, right, or something close to that, do you foresee any problems with a sold-out State Farm Stadium when the Cardinals play, or the D-backs at Chase Field down there?
So it may still be a little while for a sold-out arena, but we are looking at bringing those major sports back. We've been working with the Cardinals and the Diamondbacks and the Suns. When we anticipate about 55 to 60% of Arizonans want the vaccine, we'd obviously like to have higher vaccination rates. So we'll still be working past May and June to get as many people vaccinated as possible, but that's going to be a great start to returning to some of those types of events.
And maybe this is more of a philosophical decision, but if you've got, say, 40% of our population who says, you know what, I'm okay, I don't want to get this vaccine, should the rest of the people still be required to wear masks because those 40% didn't want the vaccine?
So as we get into more and more people vaccinating, we're going to be looking at the masks. Really, the masks is to prevent that asymptomatic spread to those high-risk individuals, and hopefully by that time, those high-risk individuals will all have had an opportunity to get vaccinated. So we're continuing to review the data, but hopefully, soon we'll be able to get rid of the masks and the physical distancing.
Yesterday, you and the governor were both out at State Farm Stadium, speaking of State Farm Stadium, where you handed out your 500,000th vaccine in just a couple of months. So congratulations on that. And what was that like? You actually gave the shot. There was some satisfaction there, I would imagine.
Yes, that was a very exciting milestone to hit 500,000 just at that one site, and accounting for half of all vaccines provided at all NFL stadiums across the country. That was very exciting. You know, I found that actually being out there and vaccinating, I'm out at State Farm and Phoenix Muni doing vaccinations every once in a while, and it's really rewarding. People are so happy and so grateful, and it's, you know, everyone understands that this is how we get back to normal. So it's a really great experience, but yesterday was really cool.
And it's a point of pride. I mean, I've watched it with pride as people all around the country, including President Biden and the Vice President, went out there and kind of toured that facility. They did it virtually. Who was the brainchild behind this? And why are we so much more effective than so many other stadiums?
So we have a great team between the Department of Emergency Management at this state and the Department of Health Services. We worked with our healthcare partners, took their best practices from their pods, and were able to do that. You know, Sheldon and Rachel and Jenny out at the sites have been doing a phenomenal job of continuous improvement so that it just keeps getting better and better.
Yeah, a few little speed bumps along the way, but congratulations on this milestone. 1 million people fully vaccinated, 500,000 out at State Farm. Dr. Christ, always great talking with you, and thank you again for you and your team's efforts in this fight.
Thank you.
Yeah, take care.